Hi everyone. In this video, I'd like to introduce the general process of diagnostic nuclear medicine. Diagnostic nuclear medicine is a non-invasive imaging modality that utilises radioactive substances in the diagnosis of disease. A key component of diagnostic nuclear medicine is the radiopharmaceutical, which is comprised of a radioisotope combined with a pharmaceutical or a drug-like compound. This is administered to the patient either orally or intravenously. Within the body, the radiopharmaceutical then localises in specific organs or cellular receptors, allowing medical imaging based on the radiation emitted from the radioisotope component. This schematic outlines the overall process of diagnostic nuclear medicine from start to finish, from the production of the radioisotope to the reporting by the clinician. We will now discuss each step of the process and also further details in the section of the course. One way of producing radioisotopes is using a particle accelerator, such as a cyclotron, like the one you can see on the left. Radioisotope generators, like the one displayed on the right picture, are also sources of radioisotopes. The next step of the process is radiopharmaceutical preparation. Depending on the type of radiopharmaceutical, this can be by either radiopharmaceutical reconstitution or by more complex radiopharmaceutical synthesis using an automated synthesis module, such as the one in the picture. The choice of the radiopharmaceutical depends on the disease or organ of interest that needs to be imaged. Quality control is then performed on a sample of the radiopharmaceutical to ensure that it is safe and fit for its intended use. Once quality control is completed and has demonstrated that the radiopharmaceutical has passed specific test criteria, a portion of the radiopharmaceutical is administered or injected into the patient. The patient is then imaged using a scanner. There are various types of scanners available, and they are generally categorised as either SPECT, an acronym for single photon emission computed tomography, or PET, positron emission tomography. You would have learnt about the modality CT in an earlier section of the course. There are hybrid scanners that use a combination of imaging modalities, including SPECT with CT and PET with CT, which can provide additional information about the disease. The particular scanner pictured is an example, the SPECT CT scanner. The choice of scanner used is linked to the particular radiopharmaceutical, in particular the type of radioisotope that it contains. Here, a patient is undergoing a scan with a SPECT CT scanner. The moving parts that you can see are the scanner's detectors moving into position and then rotating slowly around the patient. The radiation emitted from the patient is then detected and turned into signals used to generate the image. After the scanning is complete, the images acquired are processed using sophisticated software and then assessed or reported by clinicians. I hope that you enjoy this section, and once you complete it, that you will understand the basic principles of diagnostic nuclear medicine. Coming up next, we will cover in more detail isotopes and radioisotopes.